Hello. Hi. This is your oncologist Dr. Chaitanya. We are here today to discuss regarding normal doubts and all the myths which are prevailing regarding cancer and its treatment. So coming to the first point, which is fourth and foremost point, which is always discussed, is what is cancer? What is cancer? So if we go by a layman terminology, cancer is uncontrolled proliferation of cells. So for example, if our body structure and everything is in a uniform way, it is because of replacement of dead cells by newly forming cells. Everything is under control. In cancer, the proliferation of a particular cell is not under control of the body, which ultimately results in a mass and ultimately causing a lump or tumor, whatever you say, that will be resultant in a cancerous disease. And one more thing, most of the patients ask us, is tumor is equal to cancer? Does tumor represent cancer? So if we go in depth of it, tumor is a generic word. Tumor is usually used to indicate any swelling in the body. It can be further divided into benign and malignant disease. Benign is a harmless tumor. Malignant is a kind of harmful tumor, which is a cancer. But in general terminology, people use tumor and cancer interchangeably, which should not be used. And one more thing, people usually ask what is the cause of rapid increase in cancer cases in India. Previously the cases were not so high. Why the cases are increasing nowadays? The reason is, first thing is lifestyle changes. Because of modernization of our lifestyle, not having a proper diet, having adulterated junk food, and also by increased awareness. Because of the increased awareness, we are able to detect cases on a huge number. Previously, any elderly who is above 65 or 70, if he gets any chronic illness, that would be regarded as age related illness and was not further evaluated, ultimately leading to its consequences. But now the scenario has changed. There has been tremendous awareness among people to get tested for everything. That has increased number of cancer cases. And also regarding lifestyle changes, in a simple example, if you see, number one cancer cause in women in India is CA breast now. So one of the causes for CA breast is obesity, which is ultimately a result of lifestyle change. Less physical activity, more junk food and all. Also late age of marriage can even cause CA breast. Late age at first pregnancy can cause CA breast. And decreased breastfeeding to baby because of increased working hours and all, that can also be a risk factor for CA breast. So these all things have caused increased in CA numbers. And what are the signs and symptoms of the cancer in general? We have many types of cancers heading from tip to toe. But in general, the symptoms are loss of appetite and unexplained weight loss, which has been evaluated on multiple occasions, but we are not getting any cause. So we have to look into any cause of malignancy, unexplained fever, that can be a lymphoma, and any lump in the body, any swelling in the body which is increasing, especially if it is painless and rapidly increasing, along with associated loss of appetite, that has to be evaluated for cancer. Any non-healing ulcer, that has to be evaluated for cancer. And any change in bowel and bladder habits has to be evaluated. And any abnormal bleeding, that is intermenstrual bleed or post-menopausal bleed, has to be evaluated for cancer. And many people also ask whether cancer is permanent. Cancer is permanent. So if we go by a philosophical approach, nothing is permanent. So basically, not all cancers are permanent, because if we detect cancer in early stage, like stage 1 and stage 2, the cure rates are very high. In stage 1, the cure rates range around 90 to 95%. In stage 2, it is around 80%. So as the stage increases, the prognosis worsens and the cure rates are decreased. So and also many people ask about celebrities getting cancer treatment. So people say celebrities get their treatment in Western countries, in USA or UK, and they have got more money. That's why they are getting better treatment and better cure results. It's not that simple. Basically, it depends on multiple factors. As far as I understand, celebrities move to Western country to get treated to avoid media and paparazzi, not because of the treatment options, because treatment options in India and abroad are almost same nowadays. And there are many cancers which detected in early stage can be cured with very minimal amount of money. Yes, some medicines are there, some monoclonal antibodies medicines are there, which are very expensive, which will ultimately be in hands of financially sound people. But we cannot write it in a line that only financially well-doing people will get cured of cancer. If someone has cough and there is weight loss, can it be a cancer? Yes, it can be a cancer, but we cannot firmly say it is cancer, because even tuberculosis, TB presents with similar symptoms with persistent cough and weight loss. So it has to be evaluated by the concerned doctor to get treatment further. And is hair loss a sign of cancer? Very, very, very rare. Chemotherapy might cause hair loss. Not all chemotherapy drugs will cause hair loss. Per se, some lymphomas which affect skin might cause hair loss. So hair loss is not a sign of cancer. It is very, very rarely a sign of cancer. And what are the common cancers found in India? Most common cancers found in India are head and neck cancer, oral cavity cancers, breast cancer, cervix cancer, and gastrointestinal malignancies like esophageal cancers and rectal cancer, and lung cancer. These are usually found in Indian scenario. What are the lifestyle habits that can prevent us for cancer? Having a healthy lifestyle like regular exertion, maintaining an ideal body weight can help in reducing the risk factor for cancer. Staying away from addictions like smoking and alcohol can keep us away from cancer. And staying away from passive smoking also helps. And having a rich diet, fresh fruits and vegetable diet will also be helpful. Having timely food, avoiding chronic gastritis, because as we all know, chronic gastritis can be a precancerous sign, so that has to be avoided. These are all the lifestyle changes that can lead to a lesser chances of cancer. What is screening? We usually hear a lot about screening in cancer. So basically, screening is a process in which high risk individuals are monitored regularly by healthcare team or a doctor, so that cancer can be detected in a very early stage, so that the treatment results are good, the cure rates are high, at the same time treatment cost is less, and also hospital stay is less. For example, CA breast, in Indian scenario, every female above age 40 to 45 years should be checking her breast by self examination every month, and should do a clinical breast examination by a trained nurse or a doctor yearly once, and getting a mammography done once in 2 years. That is a screening program. At the same time, in India, screening for CA cervix is pap smear examination every 3 years. This will help us to detect cancer in a very early stage, sometimes in a in situ stage, which is a precancerous stage, which will lead to 100% treatment result. So what are all the vaccines we have in cancer? So presently approved vaccine is cervix vaccine, which is Cervarix, which is available in India. So it is given in 3 doses, 0, 1, 2. At 0 is if you take it on the present day, and first is 1 dose after 1 month, and third dose is after 6 months of the 0 dose. That is the schedule of Cervarix. It is usually given from 9 to 25 years before, usually given before marriage, and if after marriage, it has to be given prior pap smear test has to be done. If pap smear test is negative, then we can proceed to vaccination, Cervarix vaccination. In some countries, even the cervix vaccination is given till 45 years of age. Lastly, I have heard from many people that there is some problem in my body. I don't want to get it tested because getting tested will lead to unnecessary panic, and I would not like to get any stress into the life. But as per me, it is not this way, but vice versa, because many of the lumps can be non-cancerous, which can be done without any serious oncological treatments, and even if it is a cancer, it can be detected in early stages, leading to more good treatment results. So we should never be fearing about getting tested for any kind of disease. We should get tested by concerned specialty doctor and get good results. Thank you.